At the Rangiora Vet Centre this week, Tremor is recovering after a nasty bite from a dog.
I'm Rebecca, I'm one of the vets from Rangiora Vet Centre, and today we're going to talk about Tremor, who is here. She's been here for 3 days now for treatment of her dog bite injuries, which in a wee teeny cat like a Tremor, who's only 3.5 kilos, a dog attack can be a really, really serious injury. She's mainly sustained injuries to the back part of her body, and with a dog attack you kind of think that there's going to be lots of wounds and cuts and holes, but often there's a lot of crushing injury rather than necessary lacerations and skin wounds as such, and that's what's happened with poor wee Tremor. She's been bitten around her bottom, over her lower back and on her skin here, and you can kind of see where the four sort of big canine teeth have been. She's got 1, 2, 3, 4 there, and they haven't really punctured the skin, but they've caused a huge amount of bruising, and the skin in this back part of her body's been pulled away from her deeper tissues, and so she's got a lot of bits and pieces attached to her at the moment to try to help her feel better. She's sitting purring away here. She's reasonably happy, and one of the most important things obviously with a patient like this is to try to keep them as comfortable as we can. She's on a drip here with some very strong pain relief in it called fentanyl, which is a morphine type drug, and that's going into her system continuously through her drip line here, which is attached to her wee arm, all bandaged in, and so that just gently drips in and provides her with trickle of pain relief, and we can just test that by gently touching over the injured areas and making sure she's not flinching or giving us any sign that it's uncomfortable. She's also got a wee drain attached here. Because her skin was pulled away from the tissues underneath, we don't want fluid and things to accumulate underneath the skin, so she's got a wee drain tube curled up underneath her skin here, which is attached to a little suction reservoir, and that's just gently reattaching that skin. So we're really pleased with her progress. She's eating really well today, which is super. It's always a really good sign in a sick cat if they're feeling like eating. She's responding to touches and cuddles. She's purring and smooching and wanting us to pay her attention, whereas yesterday she's sort of hiding in the back of her house. And she's toileting normally, which is all great. So we're pretty hopeful that that Tremor will recover completely. But yeah, it's a bit of a scary thing to happen. Certainly any patient who is in a dog fight, whether it's a cat or a dog, it's not often immediately obvious how serious the injuries are, and even if things look fairly minor on the outside, if you look at her, you've sort of got a few wee grazes here that on the outside don't look like too much of a big deal, but underneath those grazes there's an awful lot of deeper damage. So definitely if your pet, whether it's a cat or a dog, has been attacked by another dog or in a dog fight, it's definitely worth getting them checked over. Even if things look fairly minor on the outside, there can be an awful lot more going on underneath from that crushing force applied by the dog's jaw. Tremor, hopefully, will be home for the weekend once her drains are out and she's comfy without her fentanyl.
Be watching next week when Rebecca shows us the symptoms of kidney disease.